My name is Shanice. I'm a student at ECPI's Medical Careers Institute BSN Nursing Program. I'm completing this video in regards to our senior practicum project that we have to complete. For our practicum project, we were given the task of selecting a policy at our current place of employment to revise or creating a new policy for our current place of employment. For this project, I have decided to revise the IV policy at my current place of employment, more so adding to the policy focusing on the administration of IV medications, IV push medications to be specific. I have decided to revise this policy because when we were in an IV class, there was a debate amongst the newer nurses and our clinical nurse educators. They were very questioning about our habits and methods that we were taught on the administration of IV push medications, more so specifically the dilution of medications such as Dilaudid or morphine, Ativan, different medications as such. I can honestly say that as a new nurse, going through nursing school and going through orientation at my current place of employment, I was taught that you should dilute these different medications for various reasons that were given to me based on the person at hand at the time. So my goal, my specific goal for this project is to revise a written policy in regards to the dilution of IV push pain medications such as morphine or Dilaudid. So while completing research in regards to this project, I came across a survey that was completed in 2014. This survey consisted of 1,733 nurses that were surveyed. Majority of these nurses were staff nurses, which consisted of 82% of the total nurses that were surveyed. 9% of those nurses were supervisors, and the other 9% were nurse educators. According to this survey that was performed in 2014, 83% of nurses reported further diluting IV push medications. Now, some nurses are probably wondering, why are nurses further diluting certain medications such as morphine, Dilaudid, Ativan, and whatnot? I've researched that some nurses anticipate that there will be discomfort to the patient, so they decide to go ahead and further dilute medication prior to administration. The need for a medication to be pushed very slowly over 2 or 3 minutes would warrant a nurse to want to dilute medications further. The viscosity or the thickness of a certain medication may encourage a nurse to dilute the medication even further. And the difficulty measuring a small dose, that is the most frequent reason that I have personally diluted medication. It is very difficult to administer a small amount such as 0.5 mLs over 2 to 3 minutes. So I was taught to further dilute in 5 or 10 mLs of normal saline to ensure that you're able to push this volume over the correct time. Now, diluted medications does not seem like a big deal to some nurses, but one of the more unsafe practices that goes along with diluting these medications is unlabeled syringes. This is a large concern with a lot of nurses, nurse educators, supervisors of unlabeled or mislabeled syringes. 54% of nurses that were surveyed in the recent survey that I told you about that took place in 2014 report using normal saline syringes to dilute IV push medications. Now, the issue with using the normal saline syringes to dilute medications is that the pre-filled syringes, they've been approved for flushing different devices such as Metaports, IVs, PICC lines, but they have not been approved for the use of reconstituting or diluting IV push medications. A classmate of mine actually decided to share a story with me, and she works in an emergency room, and she did tell me that in an emergency situation, a doctor ordered a certain medication, IV stat. Another nurse drew up the medication in an IV flush syringe, a normal saline syringe, and had a regular normal saline syringe in the other hand. So when it came time for my classmate to give the medication to the patient, the nurse that drew up the medication was unaware as to which syringe contained the medication because the syringe was not properly labeled. It was not labeled at all. So my classmate then had to go re-pull the medication from the Pyxis and redraw the medication. Luckily, the time that she needed to do that did not affect the patient's outcome. But again, in an emergent situation, time is of the essence, and there's no telling what could have went wrong in that situation. A couple of safe practice recommendations to ensure that we are performing safe practices within the facilities would be polling the staff, including pharmacy, and educating the nurses. Polling the staff will give the nurse managers and the nurse educators an idea of how many staff nurses on the unit are actually carrying out these practices. From there, they can determine if they need to educate everybody on the unit about certain practices or if they need to individually pull certain nurses and educate them individually about certain practices on the unit, including pharmacy. Pharmacy dilution, you can contact pharmacy if you have any questions about a medication that needs to be diluted. Pharmacy will be able to give you that information. And if you feel that there is an IV push medication that should be diluted prior to administration, if pharmacy does not dilute it, you can request that they dilute it, or they will give you a rationale as to why they cannot dilute it down in pharmacy and why it needs to be diluted on the floor prior to administration. Educating your nurses. Education is key. Discouraging the use of pre-filled syringes, the normal saline flushes on the unit will help encourage your nurses to properly dilute medications without using these syringes. These syringes, they say that they contain 10 mLs of normal saline, but they're not specifically measured out to 10 mLs according to the manufacturer. It is a rough estimate because these syringes are strictly used for flushing devices. They're not used for the administration of medication. So during the research portion of my project, I was fortunate enough to be able to get in contact with a pharmacist by the name of Danielle. Getting in contact with her, I asked her 5 different questions to get a pharmacist's insight on this topic. So the first question I asked Danielle was, have you heard of nurses on the floor diluting IV push medications? Danielle responded, yes, she has heard of this before. My second question I've asked Danielle was, have you heard of this being done with normal saline flushes? Danielle reported, yes, she has heard of nurses diluting medications with the normal saline flushes. My third question for Danielle was, what are your thoughts on the nurses that dilute IV push medications on their own free will, without a doctor's order? Danielle then responded, from my understanding, nurses do this so they have enough volume to administer the medication via a slow IV push. If this is the reason, it makes sense. Some volumes are so small, for example 0.5 mLs, that you could never truly push it over any extended period of time. The concern from a pharmacy standpoint is the potential for drug diversion when the RN is manipulating the product. My fourth question for Danielle. If I were administering dilaudid 1 milligram per 1 ml and I dilute the dilaudid in a normal saline flush that contains 5 mLs of normal saline, would that decrease the effectiveness of the medication? Danielle then responded, no. The entire contents will need to be administered to ensure that the entire dose was given. My last question for Danielle was, what are your recommendations to nurses that are concerned with pushing a small dose of IV medication too quickly? Danielle then responded, this is a valid concern. Historically, pharmacy is not involved with the guidance on nursing medication administration because the pharmacy and nursing perspectives differ greatly. My last question, are there any other inappropriate habits related to the administration of IV push medications that you have heard of nurses performing on the unit? Danielle responded, no. So in conclusion, according to the research, we have found that there are a large amount of nurses that are performing unsafe dilution techniques such as diluting in unlabeled or mislabeled IV flush or normal saline flushes. There have been techniques that have been passed down from older, more experienced nurses down to younger, new graduate nurses. We need to, again, educate our nurses from the top down to the bottom. Now, I feel as though this topic should be explored amongst other medical facilities. And just remember, as nurses, if we're going to dilute a medication or we're going to mix a medication, just properly label your syringes to avoid mislabeling or administering the wrong medication or not administering the medication at all. Having an unlabeled normal saline flush next to a clearly labeled normal saline flush will ensure that you know which flush contains medication and which one does not. I am going to leave the links to the articles I have found and gotten my information from in the description box below. Please leave a comment if you have any questions, concerns, or any input on this topic at all. Again, my name is Shanice, and thank you again for viewing this video.